the notice provided in the classified section or as an advertisement within newspapers in our area is not adequate, since local, state, and federal elected officials and community members only look to the classified section for used or new goods in addition to services or housing options. A notice for an important matter such as the RMHF EECA requires a press release and proper alerting of the local major news organizations, which is essentially what the NCP states when it requires lead agencies to publish notice in a major local newspaper. This was not done properly for Building 4024's EECA, nor has it been done properly for the Radioactive Materials Handling Facility EECA. Therefore, public process has again been streamlined, as are DOE's cleanups across the U.S. via DOE's Accelerated Cleanups Plan. Number two, the executive summary states that the RMHF was authorized under the Federal Resource Conservation and Recovery Act to store and treat mixed waste generated at ETEC. Documentation through Campello Noel and the UCLA studies show that the RMHF not only handled radioactive materials from the SFL and the ETEC site, but also other radioactive material that was shipped to the site from around the country. Not all of these radiological products were utilized at the SFL, and I believe a proper explanation is in order if materials outside the ETEC SFL site were utilized at the RMHF. Furthermore, I found it interesting that the EECA does not list tritium as something that will be tested for and removed, when indeed tritium was utilized at the SFL's ETEC. I would hope that historical documentation has been looked at and that the data provided been incorporated in the cleanup measures, so that DOE is adequately cleaning up the site to the appropriate EPA level cleanup. Testing and remediation for site-related chemicals, including but not limited to perchlorate and trichloroethylene, should also be executed to ensure full and proper cleanup of this facility. If the DND of the RMHF is approved, I would like to know what measures will be utilized to prevent radiological or chemical exposure to the workers decontaminating and decommissioning the site, in addition to what measures will be taken to prevent exposure to the surrounding communities during the excavation and removal process. Will the constituents of concern be hauled away in casks or in open bed trucks? I appreciate the time to comment and hope that this is not the last time DOE will participate with the public and try to understand the concerns of the community. We look forward to your continued community involvement and hope to see DOE proactively looking to alleviate the community's concerns regarding this radiologically and chemically contaminated site. Thank you very much.
My name is Salkin. I grew up around the site. Unfortunately, my family and I do have a lot of health problems. And I also, by the way, found out that the room doesn't have to be given up until 11 o'clock at night. I'm not suggesting we all stay here till then, but it's really hard after standing here all this time waiting to try and rush like crazy to get 3 minutes in. I'm not even saying I'll take it all up, but I really can't speak. Now, one of the things that this says in your pamphlet here, section 2.0, removal action objectives, it says the selected alternative, meaning this removal action, will remove all remaining RMHF physical components and any radiologically impacted soil above acceptable limits from the RMHF footprint. The desired outcome of this removal action is an RMHF footprint that meets radiological cleanup standards of protectiveness for unrestricted use. Now, when you say above acceptable limits, now who exactly, people brought this up, but who exactly is doing all the surveying? Because whose acceptable limits are these?
It's got to be comment.
Well, you know what? I waited all this time because you said I can ask questions, and I have questions. So I need to know who is actually doing the survey.
Okay, it will be addressed in the comment response.
I was told by Mr. Rutherford before this meeting that here is where I have to ask him my questions. So here's where I'm standing, and I have some questions. This is what you told me outside. I stand here, and this is where I get to ask you a question, but not out there. So I'm asking, who is doing all of the surveying? Mr. Rutherford? Phil? Who is doing all of the surveying?
We will hire a contractor to do surveying, and then verification surveys will be done by the Oak Ridge Institute of Science and Education.
Isn't that contracted by the Department of Energy and Boeing?
Yes.
So therefore, you guys are watching over all of the surveys that are being done. Is that correct? Is anybody else watching over the survey?
Go back to comments. If
Look,
just
this is
it's
what I was
easy.
told.
I know it's easy to do. Just say you'd like
No,
somebody
it's not
else.
easy to do because I need answers to these questions. So it's actually very difficult for me to stand here and then walk away with no answers ever.
He doesn't know, he knows.
Who is doing all of the survey?
It's not your turn right now.
It's okay. Now, you say all of this meets all the requirements, but whose requirements? Who's doing all the survey? Whose requirements is all of this meeting? You're not going to answer?
I'm going to take, what I agreed to was to take the additional comments. I'm going to take the comments, and that's it.
I was told that this is where I ask my questions. I have no place else to ask questions.
I'm going to take the
Now,
comments.
you had said that you were going to be coming to the interagency work group meeting on Thursday at the last meeting. Are you going to be there on Thursday?
I will be there on Thursday.
So you can answer these questions on Thursday then, when you can take questions?
Is that a yes or?
I'm planning on attending the meeting.
So right now, you can't answer these questions because this isn't where I'm allowed to ask questions. Will I be allowed to ask you questions on Thursday?
Whatever the format may be for that meeting.
I'm asking you. My name's Adam. You're Thomas Johnson.
Yes.
Okay. I'm asking you. Can I ask you questions on Thursday?
I've never been to the working group meeting. I do not know what the format is.
Well, how about this? How about this? When we get there and we're out front, there's no format. It's just me and you standing there, and I need some answers to some
Okay.
questions. Will you answer
right
some
now-
questions for me then?
Right? You can even ask him when we're done with this.
I was
But right
told-
now,
Sir,
we need comments on.
I need answers to questions because
Understood.
my family and I have a lot of problems. I need to get some answers to these questions, and this right here in front of this mic is where I was told I can get some answers. So this is exactly the only place I can get answers where anybody who is here said that they would answer these questions for me. And they're all facing the other direction. You're facing me, but I'm not trying to. I literally have a lot of health problems. My family has a lot of health problems. All I want is to get help, getting this figured out. I'm not like trying to be some hard ass. I'm not trying to cause you, sir, in particular, problems. I just want somebody to sit down with me or sit here with me while anything, and just answer some questions about all of this. And I was told this is where I'll get those answers. So why can't I get those answers now? Is somebody dying somewhere else? Because there's people dying here. So is there somebody dying somewhere else that somebody needs to get to right now?
The only reason they're not answering your questions right now is because this is officially a public comment session.
That is not what I was told by you or Mr. Rutherford.
And what we're trying to do is get your comments so DOE can respond
Who
to them
does
or
all of
modify
the
it.
surveying? It's a simple question. Who is doing all the surveying? Whose requirements are you trying to meet? Is it only me that needs the answer to this?
No, everybody.
No?
It seems like it, but you're not alone.
I mean, seriously.
So
There's all kinds of studies showing all kinds of health problems, and all I'm asking is a very simple question. And this is apparently the only place I can get the answer. There's a lot of people here that need the answer. It's not just me. I'm not just standing here because I love, everything that's going on, and I couldn't wait to, find out about all of these problems.
my suggestion is ineffective problems now.
Do you know the answer? Do you know the answer?